How to relieve knee pain fast. Today I'm going to give you 5 intermediate knee pain exercises that relieve knee pain fast. Are you having trouble getting off the couch? Are you struggling climbing upstairs? Do these simple movements, exercises, drive you nuts, creating horrible pain in your knees? Then pay attention to these 5 powerful exercises. In today's video, I'm going to go reveal 5 powerful intermediate exercises that relieve knee pain fast and help you regain the strength, the stability, and the balance so you can do all the things you want to do. And we want to do it pain-free. In the last video, I gave you 5 beginning exercises. Now remember, this is a 3-part series. This is part 2 of the knee pain exercises to relieve pain fast. Also, I'm going to give you a self-test so that you can mark your progress. So self-test means you test yourself, you do an exercise, and you retest. If you do that enough, you learn what exercises help you the most. Now, if you haven't seen the beginning exercises, be sure, check the link in the description. That's your foundation. But if you're ready to take charge of your knee health, see real results in today's exercises, because they're going to get you there faster. These intermediate moves will target key muscles around your knee for improved mobility, better balance, and long-lasting relief. Now, the beauty is no gym equipment is needed, just the power of these simple home exercises that I've been teaching for over 30 years, helping thousands of patients regain their lives. Stick with me till the end, because if you skip even one exercise, that could mean the difference between progress and staying stuck in pain. Don't forget, this is a part 2 of a 3-part series, okay? Also, remember, all the things that I talk about, neuropathy, L4, L5 disc, knee pain, plantar fasciitis, I have had all of those problems myself. So not only do I treat patients with those problems, but I've personally suffered just like you. Hi, I'm Dr. Gregory Kramer. I have over 30 years of clinical experience in treating chronic health problems. I am certified in chiropractic biophysics, which is the most scrutinized, most scientific form of spinal correction non-surgically. I specialize in helping chronic problems like chronic knee pain, chronic neuropathy, chronic L4, L5 disc problems, chronic whiplash syndrome, chronic foot problems. And the funny thing is, I've had most of those problems myself. So not only do I treat people with it, I personally have had that. Now, before I continue with the video, you know what you do. Like, subscribe, and share this information. We really appreciate it. We usually make a video about every week. I'm trying to give you information to help you live stronger longer. Everything we do here is to eliminate pain, stabilize your body, and avoid surgery, which could be knee surgery, foot surgery, or spine surgery. At the end of the day, we want you to live stronger longer, extend your quality years so you can do all the things you want to do. Remember, every week's a new video. So here's the big thing. Strengthening exercises are essential for managing chronic knee pain and osteoarthritis, because when you have stronger muscles that support any joint, we take pressure off the joint. Osteoarthritis, or degeneration or degenerative joint disease, is a factor of a couple things. 1 is trauma, but 2 is pressure and time. When your body is out of alignment, you put more pressure on the joint, whether it's your knee, your ankle, your spine. And over time, those joints wear out. But if we can strengthen the supporting muscles around it, that can add quality years, eliminate pain, improve your strength, and most importantly, improve your balance so you can do the things you want to do. So we want to do our activities of daily. We want to be able to walk, climb stairs. You want to be able to get off a couch. Now remember, regular exercise can reduce inflammation, slow the progression of osteoarthritis, and offer long-term relief and improve your quality of life. These exercises I'm about to show you are next level. They're intermediate. If you're new to my channel, go back to the beginning exercises. Please do yourself a service. There's a link in the video description below. Master the beginnings. Every exercise, those Olympic athletes we saw this summer mastered the beginning. So go back, master the beginning, then come back and watch the intermediate. Once you've built a foundation, you're going to love these exercises. Take your progress to the next level. Let's dive in and let's get started. So in this exercise, we're going to foam roll for 1 minute per leg. All right, you're going to set a timer. Now in the video, I'm not going to do it for a minute, but we're going to foam roll. We want to soften up the muscles on the front. This is your quads. And on the side, which is your TFL. Now, if you want to do it and make it a little easier on you, you can go on a pad, all right? But if you want to make a deeper massage, you go on a firm surface. Okay, we start with 2 legs, knees above the foam roller. Slowly bring your heels to your butt. We're going to do that 10-15 times. Go to another spot. Tighten your stomach. There should be no sagging of the spine. Tighten your stomach. Go to another spot. Now, we are attacking and stretching the muscle. So and I'm using an analogy, like pin and stretch, tack and stretch. We put pressure on the muscle, then we stretch it by bringing our heels to our butt. Focus on time, okay? Focus on keeping your stomach tight. Your spine shouldn't sag. There should be no back pain. This is great because it's good for your core, and it's also good for your knees. Now, if you find a tight spot, spend more time on it. That's like a knot. You're combing out a knot. This takes a lot of pressure off the knees. If you want something a little more aggressive, you can use a foam roller with knobs. I like deep knobby tires, okay? So you can do, also you can do 1 leg if you want it harder. So if you want to make it harder, do it 1 leg. If you want to make it easier, use 2 legs. If you're kind of in between, you can do 1 leg, but you can have your opposite leg just touch, like a kickstand. So I put this foot, my left foot is a kickstand, and most of my weight is on my right. And I stay on a spot about 10-15 times. I go to another tight spot 10-15 times. Another spot 10-15 times. And I hit the muscles from above the kneecap all the way up. So you'll hit 3 or 4 spots. Do it for about a good minute. Now, if you want to do your TFL or the sides, what you're going to do is you're going to get on your side, and I'll do it this way. And you're on your side, and you can take 1 foot and support. So notice my support leg is in front, and set the timer for about a minute. You go all the way down to your hip and kind of roll back and forth and find those tight spots. Search for the tight, tender areas. And then you can stay on the spot, bring your heel to your butt, and if you want to make it harder, you can put a lot of pressure. Search, go all the way to the hip. Search, go back and forth. So you're kind of rolling back and forth on this, okay? Now, that's your warm-up. We showed the TFL. Now another warm-up is just marching and holding for a second. Okay, where you hold. Now, I recommend you do it near a wall or something safe. Hold for a couple seconds. I got a support here. Down. Hold for a couple seconds. If you want to make it a little harder, you go on a cushion where there's a little give. And now you hold. It's much easier on a flat surface. If you do it on a surface that moves a little bit, like a cushion, it's a little harder. Okay? Now we're going to show a hip stretch. The better our hips move, the less pressure on our spine and our knees. So we're going to show something called a 90-90. This front leg is bent 90 degrees. The back leg is bent 90 degrees. Notice 90-degree angle, 90-degree angle, 90-degree angle. Chest out, good tall posture. We're not stretching your spine. You're aiming your nose to your knee, kind of, in that direction. It's not, don't bend your head just because you can do it. Just your spine and is a good tall posture. Your ear, your shoulder, and your spine are straight. And then we aim towards our foot. And then we aim chest out, chest out. We spend some time, we can twist, and then we switch to the other side. 90-90, great for the hips. 90-degree front, 90-degree in the groin, 90-degree here, nose to knee, nose to toes. We can throw a little twist in, and then we can go back and forth like this, getting our hips nice and mobile. Again, I use a timer. 1 to 2 minutes would be sufficient. Our next exercise is a strengthening exercise. Now remember, our test is squatting. How far can we squat without pain? How far can we squat stable? When we squat, we don't want our knees to go in. So now we're going to do a 90-degree squat without a chair. So once you can do 30 or 40 or 50 squats to a chair without pain, with your knees nice straight tracking, you can have your toes point out a little bit, and you have good balance. Now we can do it without a chair. Hands forward, push your knees out, sit back. You're looking straight ahead, sticking your butt out. You hip hinge, pushing your hands forward. You're pushing your knees out a little bit. And go about 90-degree angle. All right, now we're gonna do something called a step down. I recommend a couple inches, 3 to 5 inch. So what you do, you take this foot, have your hand next to something, support, and gently step. See how slow I'm stepping down? This is terminal knee extension. This is using the muscles above your knee, the vastus medialis, that really protect your knee. It's gotta be pain-free. It has to be pain-free. So if you do the exercise in the order I show you, your knees should be warmed up. We should help a nice movement by doing the self-massage, the foam roller or massage stick. You should have built up with the intermediate exercises in the beginning. So you go down, touch, and come back up. I recommend 5 reps. And I recommend a couple seconds on the way down. 1, 2, 3, pause, stand up. So at least 3 seconds lowering. 1, 2, 3, stand up. Do both sides. 1, 2, 3, stand up. 1, 2, 3. Now you can start at 2 or 3 inches, then gradually work to a step. But it's got to be pain-free. If you want to make it a little more challenging, you can use one of these cushions, okay? These cushions make it a little bit unstable. So now it's a little wobbly. So that's a kind of an intermediate progression. So again, same concept, we go down slow, 1, 2, 3, stand up. Super slow, and we can put our hand like a kickstand and down. Super slow. 5 reps every day, don't forget both sides. And this is a little bit harder. You notice a little bit of wobbly, it's challenging. Remember, everything's got to be pain-free. If this is too hard, then we make our depth a little shallow. Remember, we want progression. We want it to be easy at first. So it could be only a 2 inch, like a 2 inch from a 2x4. Or we can build it up like a full step, 4 to 6 inches. Pain-free. Progressions would be a higher step. A progression would be one of these pads that you can get on Amazon. It's very cushioned, so it's a little bit unstable. All of these things help you. Remember, slow, progressive, a little bit every day. Do the exercises in the order I suggest, and these are going to be a huge benefit to your knee, allowing you to reach your goals of eliminating pain, better strength, better stability, so you can do all the things you like to do, like walk, climb stairs, get off a chair or a couch, and eventually get your life back. Last exercise we showed before is the front of your shins. This is called a tibialis raise. Put your feet in front of you, both legs up. We showed this before at the beginning. Hold for a couple seconds. Now we do one leg. Challenging, see? One leg, very hard. We do both sides. That's a one leg tibialis raise. Again, 10 to 15 reps, or what you can do, just do a minute of all the exercises. So 1 minute warm up, 5 exercises, 1 minute each. So you're around 5-6 minutes, and give or take, if you want to do 2 minutes, now you're at 6 to 12 minutes. So 6 to 12 minutes a day, so you can eliminate pain, improve your strength, improve your balance, so you can live stronger longer. I think it works to you. All right, guys, try these out. Let me know. My goal with these knee exercises is to provide you with a home-based rehab routine that helps strengthen the knee, relieve knee pain. With this new set of exercises, you have an additional set of key intermediate level moves to build your progress, improve your strength, stability, and mobility from the comfort of your home. These exercises are designed to take the stress off your knees. They're designed to take your results to the next level, manage the pain, regain full function in your knees. Now remember, yes, there are things we can do in the gym. Yes, there are weighted tibialis raises. Yes, there's a variety of things you can do in the gym, but many of you don't go to the gym. So I want to provide home-based. Now, I want to hear from you, right? I want to know, literally tell me which exercise was the most helpful. Was it the hip floor stretch? Was it the one-legged tibialis raise? That's a hard one. Leave a comment. Let me know. If you found value in these knee exercises, please do me a favor, like and share it. Our goal is to eliminate drugs, eliminate surgery for the majority of people. Now remember, hit that subscribe button if you want more tips on how to relieve knee pain, avoid surgery so you can live stronger longer. Now in the next video of this knee exercise series, we're going to guide you through advanced exercises designed to further strengthen and stabilize your knees. Go watch that video here.